Nurses must be as proficient in communication skills as they are in clinical skills. We started back in 2019, and we were tasked with coming up with a problem in our unit. And we were supposed to be looking at the overarching umbrella of sepsis, and we kept coming back to communication, starting from communication from the emergency department to critical care when a patient is admitted. And then it led us to just communication from one nurse to the next. And then we came to the communication that we bring to our multidisciplinary rounds. We used to work on a paper form for our multidisciplinary rounds where the nurse would go into their chart, pull all this information onto a piece of paper, and basically it was a double, triple charting item that we had going on. So we looked into a way to streamline that communication by creating a smart phrase for our 12-hour shift summary and multidisciplinary rounding form. The dot phrase that we created has an opportunity for the nurse's 12-hour summary. So it gives a 12-hour update, a concern section, and then it goes into a head-to-toe section where we pull information from Epic, which is the EMR that we use, and it gives the opportunity for nurses to add more to each of those head-to-toe items. So we go through neuro, cardiac, pulmonary. If they're on a ventilator, that pulmonary section will bring in some information about that. We then get down into TMAX, which gives our providers then some information about our infectious state. We then get into more infection prevention stuff by pulling data from the chart on Foley days, central line days, and just bringing that information forward for our multidisciplinary rounds. We started out with our informatics team by just building a pilot. So we built our tool and then we ran a pilot. We pulled about 4 or 5 nurses from each shift and asked them to utilize the tool for a 2-week period and then provide us feedback. I've had a couple of my more senior nurses tell me that it makes a really big impact on the end of their shift. Because if you think about your shift where nothing has gone right, your whole shift has been constant motion, maybe you took a break, maybe you didn't, and you're trying to sit down at the end of your shift and piece everything back together, this note gives you those prompts. You don't have to sit down with a blank page on the EMR going, where on earth do I start my note? It really gives you an outline for how to pull your note together, which is very beneficial on those extremely busy days. Starting with the skilled communication, which is what our project really focused on, is a great place to start, just because communication and sharing your why of a project with your team really goes a long way with people.
Each of the 6 healthy work environment standards includes a list of critical elements. In this project example of skilled communication, Providence Sacred Heart Hospital established a formal structure and process that ensured effective, respectful information sharing among the healthcare team by creating and utilizing an electronic health record smart phrase. This smart phrase was used as a template for bedside report, multidisciplinary rounding, and for creating end-of-shift notes. Each member of the team focused on finding solutions and achieving desirable outcomes. They sought to protect and advance collaborative relationships among colleagues and work to access appropriate communication technologies while being proficient in their use.